I was in the early years of middle school when received a rude awakening of my family's realities of living in the US. At this point in my life, we lived in the US for about 8 years. It was our seventh major move. I was in a pretty large city that felt isolating, especially for my mother, who did not speak the language and lacked the cultural and social supports. My mother was highly dependent on us kids. Um, I'm the eldest girl in my family of seven siblings at the time. And though I wasn't the oldest, it still carried a huge significance and responsibility culturally. And some of these supports and my mother's inability to know the language and the cultural navigation led me to really be a second mother to my siblings. And I remember the times that my mother did try her best to integrate into the culture of the US. And, you know, from time to time, she would be sitting in the back patio roasting fresh coffee beans and flip through her notebook and try to recall what little she was able to remember from her English classes. And I think the saving grace was we lived in an apartment complex at the time that I called the mini United Nations, because there was people from all over the world. But it was a saving grace for my mom, because though she didn't speak English, she did know other languages. But I also saw how not being able to speak, read, write was debilitating to my mother. It broke her. And we had to do a lot of things on her behalf, right? Like, we were her voice. We were the writers. And that was really sad. So on a cold fall day, we were coming home from school with the same routine. We were sort of latchkey kids. We'd come home, and we had a routine. I'd pick up my younger brother from the babysitter if he was there. We'd play at the playground. There was a community center where we can go and do our homework. And that day we were going in and out, same as always. My mom was home. And evening came, and I noticed that, you know, my mom, she eventually, you know, she took a cat nap or a power nap, as she would from time to time, on the couch. And I thought nothing of, right, initially. But as it got darker, I noticed that my mom was still lying on the couch. And I became more anxious. And so I called out for her name. I said, "Mom, you know, Mom." I went over to her and I tried to shake her awake, "Mom." And I did this for what felt like a really long time, until I realized what was actually happening. And so I frantically called 911, and the ambulance came and took my mother to the hospital. The events that followed were a really scary blur, but one clear fact that I remember so vividly was that my mom didn't have the supports that she needed. I remember we joined my mother at the hospital. She regained consciousness, but she was so confused. My dad was actually out of town, and I remember being in the hospital and just being by my mother's bedside and having providers come in and out. And the only source of language support that the hospital provided was my 11-year-old self. Here, trying to interpret really complex medical terms, right? I knew my language, but medical language is on a whole nother level. Emotionally processing what they were saying about my mother's condition, which was quite critical. And just feeling like I was doing such a disservice to her, and that the system failed her yet again. And it really showed days and months after discharge when, yes, my mother got better, but her prognosis wasn't good because she went back to her normal life. She engaged in the same things that were contributing to her deteriorating health. So I remember feeling helpless, alone. And when I think back to inequities, I think about that situation. I think about my family's journey of really injustice, in which I put a lens in which I viewed the world, never feeling like I could just be, but that I always had to advocate. So again, here we are in a country trying to navigate systems, feeling the burdens of these realities, and seeing that the social and cultural integration was debilitating to my family. And my mother, she was a highly social person. And it was sad to see how there were things beyond her control that led to her deterioration. So the frame of injustice and inequity in which I experienced early on lit an ember in me, in which didn't allow me to sit still, and were so pivotal to where I am today in life and to do what I do. And over the years, I've pondered the questions, why doesn't the system understand? And I remember one year as a New Year's resolution, I would say, my word this year is like, I don't understand. A statement, I don't understand. And I remember a good boss and mentor of mine said, Nyabony, it's not that you don't understand, it's that you don't accept it. And I was like, yeah, you're right. So I'll use that instead. But I pondered these questions again, like, why do we keep doing the same things that we know aren't working? And why do we wait until the very last minute to go back into communities to ask for their perspectives and their solutions as an afterthought? And the damage is already done. So coming into the fellowship, I was a little hopeful, but I also wanted to understand, is there something that I was missing, right? As I was in these spaces, I was advocating for people. I felt like I was shouting to the rooftops and nobody was listening. And I was really, there was just a lackluster application of equity. And after 23 years of fighting, I came into this fellowship feeling really exhausted and cynical. My project in the beginning also added to this feeling of hopelessness, because what I thought was a really strong partner ended up being, sadly, not a good one. For months, we were left in the dark. We weren't communicating on the same wavelength. And a couple of months in, we were debriefing with other community health workers just around how do we create a platform for community health worker voices, a certification pathway. And as I looked, around the room, I noticed that we were all women of color and that we were sadly being tokenized. But what pulled me out of, not slumping back into that cynicism and that feeling of hopelessness were the things that I learned in this fellowship around psychological safety, mapping out actors and allies. And it provided an alternative pathway to my way of thinking about these experiences. And I also had a really big revelation that systems are people and people are systems. And when I had this revelation, it was like a relief because I saw that change was possible. To not try to change and to accept for things as is, right? Or to continue to say, I don't understand, would be to perpetuate those same inequities. And if people make up systems, then there are indeed things happening behind these structures that boil down to relations and life. A few weeks ago, I was in a project planning meeting for a new community project, and many of the individuals I knew, and so we were catching up. And one shared about a mutual youth that we knew who had to miss a really important conference in our community. And she said the reason why he missed that conference was because he had to fly down to be an interpreter for his family. His father was going to undergo some major surgery. And I remember being so flooded with emotion. I was like, what? Wait a minute. That's not right. And it took me back to my 11-year-old self. And my first reaction on the spot was, right, again, this isn't right. The hospital is doing wrong, right? If they're federally funded, right, like they have this obligation to provide interpretation services. And right, all of these assumptions bubbled up. And, the ways in which I would intervene to save this family from what was about to happen. And after that meeting, I still thought about that particular situation. And if it wasn't for this fellowship, I wouldn't have saw the other side and pondered alternative interventions and, use things like open and honest questions, which invite us to be curious and not defensive. And it helped me to drum up a more graceful response and perspective. So instead of asking, why is this facility intentionally asking the family to do something they know isn't right, of using a child interpreter, I shifted from perhaps the family wanted the youth to be there because he was there from day one of his father's illness. Or that whoever scheduled their appointment just didn't know the hospital procedures around setting up interpretation services. Whatever it was, the tools that I learned in this fellowship, the perspectives that I learned from other fellows, and particularly Abel's session around centered presence and building people's house led me to think, to take a deep breath and to try to break down that scenario or that situation in a way to see systems as people. And it shifted my view to visualize, the balcony, and, climb up out of the crowd to see that, there's many other forces happening. I'm happy to share that though in the beginning, my project didn't, the partner that we had wasn't a positive experience, that we did find others who were just as passionate, and that building a training and certification pathway will be possible. And it really came again in that revelation of seeing systems as people and navigating that complex relation that hopefully we can co-create policies and spaces in which people feel comfortable enough to build things that are representative of community. So this fellowship experience was not what I expected. It's been rejuvenating in ways that I didn't know that I needed. And I've been able to use principles that I know I'll use for years to come. And that, towards our collective effort of fighting for health as a human right. And I'll hopefully cringe less right? When people say, sorry, I can't help you because, you're not stable enough to receive our services, or, they have these arbitrary guidelines that someone doesn't meet. I'll still cringe, but maybe cringe less. And I'll see opportunities to lean into tools like appreciative inquiry that invite us to use language and see solutions as humanistic. I've learned that equity is and should be a collective contribution. And because of you all, I'm making a recommitment to speak up again without shame. It may not be soft, but I know it's needed. And it's possible with you all as beacons around the world. Equity is also relational in nature. And one word from the African philosophy captures it all: Ubuntu. I am because we are. We must break down silos and do the inner work at the same time. And when we do this, we will reap the true power of what late Mother Teresa said: I alone cannot change the world, but I can cast a stone across the water to create many ripples. We all thrive when we recognize that in water there's hope. It may not flow in the direction that we hoped. It may be painfully incremental, but it's still moving, and that counts. Thank you.